Presented by Nicholas Goodall.
Jay Millett.
And Ishal Ramesh. Out of the numerous numbers of heart transplant made across the nation, how many do you think are decided fairly for each candidate? In reality, the factors that determine if a candidate is eligible for a heart transplant is not exactly set in stone. Factors being economic, socially, and health-wise, and within them they could be the cost, the probability of success, and the urgency. So the patients we're given here are out of 5. So patient A, she is female and she is 41 years old. She is a recovering alcoholic, a single mother of a 6-year-old child. She has a steady job to go back to after rehab, and her main goal is to want to be with their family. While patient B, he is a 59-year-old male who works hard hours with very little pay. His ultimate goal is to be with his family as well. And patient C, she is a female of 30 years old, very work-oriented. She does smoke and she does drink socially. And she is physically active. That is where she found her irregular heartbeat. And for patient D, he is a male of 35 years old. He does not smoke, he does not drink, he has no criminal offenses, he is relatively wealthy, and he is employed with insurance. And his ultimate goal is to be with his family. And for patient E, she is a female of 35 years old. She is homeless, she does not have insurance, and she has no family, and she's experiencing severe heart issues.
How does certain factors affect patients' chances of receiving a heart transplant? Social, economic, and ethical and health factors play a role in the process of donating a heart. Finding one can take a time, and it may have to wait many months in the waiting list. Donor must be in good health conditions and must not be fighting any diseases. We chose candidate A because she has a daughter and she's a widow and she has a 6-year-old daughter and she provides for her family.
Our primary factor is the level of importance that a mother has on a family dynamic is essential since they maintain the role to nurture and guide their child, complete daily responsibilities, create stability, and ensure the well-being of others in the family. As we can see in the pie chart, this is the average care mothers are giving to their children, where it shows single mothers are giving less care than regular mothers in a relationship. Single mothers have tasks to complete the father's role and the mother's role, completing an overworkload, in which why we chose a single mother to get the heart transplant, which lessens her stress levels. Evidence 2 supporting our primary factor is, according to the National Library of Medicine, single mothers having a higher level depression level, single mothers having higher depression levels due to having a less social active life, prioritizing their own family.
A secondary factor that insurance is necessary for covering any medical expenses or costs. Without insurance, having any surgical procedures can be very financially detrimental on the patient and the hospital. For example, as we see in the chart, patients with insurance such as Medicaid, Medicare, or private insurance get off the waiting list more easily than patients without. So we can correlate this back to the mother whose company who gives her insurance. She'll have a higher chance of getting off the waiting list than others. Another example is this chart right here. How much insurance covers percentage-wise. As you can see, there are different insurance companies that cover. There are different insurance companies that have a certain percentage of coverage. Let's say we are comparing the private insurance versus the Medicare insurance. While private insurance covers over 3.3% of the post-transplant, 53.3% of the post-transplant, Medicare insurance covers over 3.3% of that. We can correlate this back to the mother, who insurance company covers for the average over 20% of this. This can give her a higher chance factor of getting a heart transplant.
The opposing factor, while candidate A does contain the qualities that make her an eligible candidate, there are others that do not make her a fit one. Her history of alcoholism increases the risk that she'll abuse the heart she is given, when it could be given to someone else who is less at risk for addiction that could damage the heart. However, she has had 14 months of sobriety, which demonstrates the effort she's willing to put into fighting her addiction.
And in conclusion, the general process of determining the allocation of a heart may be a disadvantage to many, with certain factors trumping a candidate's eligibility of receiving a heart transplant compared to others. Social, economic, and health factors play a substantial role in determining their chance. While hospitals and foundations strive to be objective when it comes to making decisions, personal values do come in play when determining where the heart will be.
Thank you.
Thank you.